Gurubhyo Namaha. Namaskaram. Good morning, ladies and gentlemen. My name is Ganesan Sreeram. I trust you are all doing well and taking care to prevent the spread of COVID-19. Welcome you all to our virtual health seminar session presented by the youth on a very important topic related to COVID-19. Before I switch over today to Sadanand ji, there are some housekeeping rules that I request you all to follow. The number one is as soon as you log in, please mute your audios. Please switch off your videos as well. This will allow us to focus on the speakers and their presentation. If you have any questions during the program, kindly post it on the chat and hopefully it will be addressed at the end of the program. The program is also on Zoom in our SVBF Canada website. And if you go to SVBF Canada website, you will find the link for both the Zoom and the YouTube. If the Zoom participants are overflowing, then it automatically gets into the YouTube. And lastly, we do not anticipate any technical difficulties, but in case there are technical difficulties, please bear with us. Have patience and let us enjoy this the wonderful seminar and good information that our youth have presented for us. Now, without further delay, I switch over to Sadanand ji for more on today's program. Thank you.
Thank you, Sreeram ji, for those words of technical housekeeping and also all the support that you have been giving. Good morning, everyone. Welcome to our 6th webinar on health awareness. This webinar has been sponsored, organized, and presented by Sringeri Vidya Bharati Foundation and Ontario Konkani Association. Before we get into it, I would like to introduce the Vice President of SVBF Trustees and Heart and Soul of our temple, Dr. Param to give the message on behalf of SVBF. Dr. Param.
Okay. Thanks, Sadanand. Om Shri Gurubhyo Namaha. Good morning, everyone. On behalf of SVBF Canada, it is my pleasure to welcome our young and bright speakers of today and all of you in the audience for today's special webinar. Before we start, I'd like to say a couple of words on who we are and how we are coping with the COVID-19. Sringeri Vidya Bharati Foundation, or SVBF Canada, is a religious, educational, and community-centered institution established about 10 years ago in Toronto. We are an overseas affiliate of the highly respected Sringeri Mutt of India. Here at SVBF, we are not only a religious institution with the Sharda Devi temple, but we are much more of an educational, community, and cultural organization with large facilities, auditorium, Adi Shankara Museum, library, etc. SVBF is now open at a reduced capacity following all government regulations. And I invite you all to come and visit us here in Toronto at your convenience, utilize our facilities, and take part in worship and other activities. SVBF, particularly now under COVID-19, is sustained by donations from people like you, and we appreciate any financial support you can provide. We are a Canadian registered charity, and our donations are tax deductible as well. If you would like to make a donation for this type of educational programs or any other SVBF activities, please visit our website, svbfcanada.com. Now, once again, I welcome our youthful speakers who have volunteered to talk about the issues of the day and all of you in the audience. Now, I request our friend Sreeram to play a short video clip showing how we at SVBF are getting ready or are ready to welcome devotees and other visitors. Sreeram, please.
Sringeri Vidya Bharati Foundation, the abode of Goddess Sharadamba, welcomes all devotees to the temple to participate in a variety of events. Volunteers are taking the utmost care to make sure that the temple is clean and totally disinfected. We are following all the health protocols put forth by the government. Devotees are assisted in following these protocols, such as washing your hands, wearing a mask, and maintaining a safe social distance. At a time, the temple will be allowing up to 50 people. For all your traditional, spiritual, and cultural needs, Sringeri Vidya Bharati Foundation is your abode. For more information, visit our website at www.svbfcanada.com. Please subscribe to our YouTube channel to watch upcoming live streams and prior recorded events. May the grace of Lord Sharadamba be with you always.
Thanks, Sreeram. And Sadanand, please continue.
Thank you, Dr. Purambat and Sriramji. The program, as I mentioned earlier, is co-sponsored by Ontario Konkani Association. We thank them for their continued encouragement, assistance, and support. It gives me great pleasure in introducing this president of OKA, Surekha Shenoy, to say a few words.
Thank you, Sadanand. And it's always a pleasure to come and attend these webinars, which are so educational and important at a time, challenging time that we face. On behalf of the Ontario Konkani Association, I want to thank everyone and welcome everyone to this great presentation today, or the webinar, I should say, on a topic so important to everybody. Mental health and stress is something we all know. I'm not sure if there's anybody who has said they have never faced stress or how we deal with it. It's a topic that hasn't got much attention or of recent is becoming something that people have started talking about, and it's important to continue those conversations. I am so impressed with our speakers today, so young and yet so aware of what's needed in the community out there. And I'm looking forward to their webinar or their presentation today. They have founded a not-for-profit organization called CHERI, and I was looking up on that. Amazing entrepreneurs. Thank you for your volunteering efforts, and I look forward to your presentation. And again, thank you to the Sringeri Vidya Bharati Foundation for partnering and bringing such important topics that are dear to everyone. Thank you, and welcome to the event.
Thank you, Surekha. Excellent message. We're going to start today's webinar with an update on the COVID status, especially considering the recent developments and some rules and regulations brought up by our Premier. So it gives me really great pleasure once again to introduce Dr. Professor Arun Chockalingam. He's a professor of medicine and global health at University of Toronto. He was the founding director of global health at University of Toronto, founding director of Office of Global Health at US National Institute of Health, and founding director of global health at Simon Fraser University in Vancouver. We are extremely fortunate in having him amongst us, and it is with utmost pleasure I present to you Dr. Arun Chockalingam.
Namaste. Thank you, Sadanand-ji. It gives me a great pleasure to come back and join along with the youngsters. So in Tirukkural, we have got a saying which says, "ஈன்ற பொழுதில் பெருதுவக்கும் தன்மகனை சான்றோன் என கேட்டதாய்." The mother gets so much pleasure when her children have achieved a greater height. And that's what's happening. We will witness in a few minutes from the youngsters who are going to educate us. But before that, let us come to reality and see what is the situation of coronavirus that we are dealing with it for the past 6 or 7 months. And it looks like it is going to be staying with us. Let me just switch to my screen so you can see my screen. For the full screen. So the question is, are we safe? Now, before I start that, let me dedicate my talk to a most reverend Canadian who has given 6 decades of his life for the welfare of Canadians. That is the 18th Prime Minister of Canada, John Turner, who passed away yesterday. Canada lost a great citizen. With that dedication, let me start. If you look at the world map and look at the countries where the COVID has affected the most, you can look at the intensity of redness. You see the countries where the greater redness are shown. And as of yesterday, the numbers were 30,600,000 cases and about 953,000 deaths. Now, as of this morning when I looked up, the number of cases went up by another 144,600 and the number of deaths went up by over 4,000. So if you look at the countries in the rank order, which has got the highest levels, in this slide you can see the rank order on the left column and then the countries and their population, so that you can compare based on the population and number of cases. US is leading the charge with over 6.75 million people having been affected or being affected by COVID and close to 190,000 deaths, followed by Brazil and then India with its 1.38 billion population. The number of cases has gone over 5 million, 5.3 million, and the number of deaths have gone to 85,000. So where do we stand in terms of Canada? We are not in a very enviable position. We are still ranked number 20 out of 192 countries. In Canada, for a small population of 38 million people, the number of cases is about 144,000 and the number of deaths is slightly over 9,000. Now, if we take the 7-day rolling average, the rank order changes. So here's the rank order of the 7-day rolling average. The cases are shown in black and the deaths are shown in red. So there's 90,000 per day on an average over the last 7 days in India, and about 40,000 in the United States on a daily basis, and about 29,000 in Brazil. So you can see the change in rank order, 1, 2, and then 3. And likewise, even the number of deaths, if you see, the numbers are pretty high on a daily basis. This is not a very comforting position because many of the viewers on this call are from South Asia or from India. So it is not giving us a comfort feeling for our parents and our families who are living back home. Now, what about the situation in Ontario and in Canada? In this chart from Government of Canada website, so the number of confirmed cases as of last night in Ontario is 46,484 cases. and the deaths were 2,826, and the number of people who have recovered is 40,000 plus. The small numbers that you see within the square, the 407, that shows the number of cases that was the increment from a day before. And likewise, you can see the confirmed cases in Canada and the world for comparison. Now, let's take one community or one city. This is a situation in Mississauga. On a daily basis, what is the numbers? You can see the increasing spikes, which spiked sometime in April 19th, and then we came down, and then again there was another spike, and so on. And then we came down almost on August, somewhere in the early part of August, to a very low level. And then if you look at it, and the numbers are going up. Starting from September, our numbers are really alarming. So if you look at the total situation in Ontario, in Mississauga, the resolved cases is about 7,200, and the not resolved is about 566, and we lost about 319 people. And if you go to India, which is one of the largest countries in the world in terms of population, as we saw, the numbers are quite staggering, with over 5 million people who are being affected. Now, within India, there are regional differences, and again, we can rank order among the 22 states, and Maharashtra, where Mumbai is, that leads the charge with about more than 1 million cases and about 31,000 deaths. And followed by Andhra Pradesh, Tamil Nadu, Karnataka, and Delhi. So this is really frightening and a matter of concern. Now, we are seeing the recurrence of COVID in Ontario, which prompted our Premier to promulgate the new ordinance, which is quite appropriate. See, as of 11th of August, Ontario recorded the lowest daily incidence of COVID by about 33 cases. That's the lowest we have ever recorded. But as of yesterday, if you look at it, the numbers have gone up to 407. This is extremely staggering, and all the efforts that we have put in until August 11th is now weaning away. And if you look at the 407 people who have been affected, this time, unlike the elderly people, most affected are the younger people in the age range of 18 to 40. This is because of not maintaining social distancing and partying and being reckless. So the government has to come very hard on us. We brought it upon ourselves. The new limits on social gathering has now been reduced from 50 to 10, and in outdoor gathering, which was previously 100, is now reduced to 25. This is not the only thing. You have to remember there are fines and punishments which we will be subject to if we don't adhere to the rules. It will be a new offense if we exceed the limits under the order. A minimum fine of $10,000 for the organizers and $750 for each of the attendees of these gatherings. There are wide powers given to different levels of government, and the police officers have got the right to temporarily close the premise and even require the individuals to leave the premise. If anybody is planning to organize a get-together in their house with more than 10 people, be assured that the police can come hard on you and they can temporarily close your house. And so let us continue to follow public health guidance We need to stay at home when ill, or keeping the children home from school when they are ill, even with mild symptoms. Practicing physical distancing with those outside your household or social circle or at gatherings. Many of the shops in Ontario or in Toronto GTA area, they are strictly following these guidelines, and let us cooperate and let us make it ourselves very clear not to get affected. We need to protect our social circle. Wearing mask, wearing a face covering when physical distancing is a challenge, and it is only for your own best interest, please do wear a mask when you go out. And there are certain rules in wearing the mask. You should cover your nose, you should cover your mouth, and the mask should come all the way down to your chin. And when you are not using the mask, take it off and hold it in hand, and don't bring it down to your neck, and that can pick up all the virus, and when you breathe again it will go back. And washing your hands frequently and thoroughly, as well as adhering to the gathering limits and rules. So please let us all do our part to control coronavirus. Thank you, and let's look forward to listening to the young people who have a great message for all of us. Thank you.
Thank you, Dr. Chokalingam, for that excellent update, as well as reminding us our duties. Yes, as you said, let's all follow the rules, regulations, and be wise and intelligent. We can conquer this, but with following the rules and regulations. Before I introduce our youth, the young group, which all of you are eagerly waiting, I just want to remind you that if you have any questions, please post them on chat. We'll try to answer as many questions as possible. When Padmaja, Sreeram, and her teammates submitted a proposal of conducting webinar on handling stress, depression, anxiety, especially during these difficult times, we were ecstatic. For one, the number one reason was because, as Surekha ji had mentioned, we had not touched this issue thoroughly. And here we have experienced, qualified, knowledgeable youth who were prepared to do that. And secondly, as Dr. Arun Chokalingam said, it is always a pleasure to see our youth doing so well. So, Padmaja, the time is here. I just want to mention that Padmaja Sreeram is a third-year medical student at University of Toronto who co-founded the CHERI clinic alongside her co-presenters, who she will be introducing later. She is concurrently completing her master's degree in health policy in the system, leadership, and innovation concentration at U of T. Padmaja is an experienced student leader, a passionate health advocate, and a member of our own community with a vision for building an equitable health system. It is therefore with the greatest pleasure and pride indeed, I'll pass over the control to Padmaja Sreeram. Padmaja, please take it over.
Thank you so much, Uncle, for that introduction. I'll just get started by sharing our slides. Just give me a quick moment. I hope everyone's able to hear me. And just going to present this way. Great. And I'll just get started. So hi, everyone. Good morning. Namaskaram. Thank you so much for inviting us and for all the wonderful introductions. We're really excited to spend the next hour or so with you talking about this topic that's really special to us for a number of reasons. So we know that we talk about mental health. I know that the health seminar here has already touched on issues like depression and anxiety, especially among seniors. But oftentimes you can't talk too much about mental health. It's something that affects us all the time, and none of us are experts, and stress is ongoing. So we really felt like we could approach it with a different lens this time. And this time we're hoping to talk to you about children and youth mental health. So it's a bit of a different perspective. And we also want to present to you, so on behalf of youth, almost what we want parents and grandparents and families to know about mental health to support us as children and as youth. So I want to get started by reading off our presentation title. So what is my child thinking? How to talk about stress and mental health with children, a guide for parents by youth. So today we'll be talking a little bit about who we are, introduce ourselves. We'll talk about causes of stress among children and youth. And just to be clear, we're talking about children as young as 2 or 3 and as old as about 24, 25, even when they're in university. So youth actually goes all the way up until that age. We'll talk about how kids and youth might demonstrate or show stress and signs that we can look for to know that someone is stressed. We'll talk about how parents, how you can support your children and your youth, whether they're teenagers or not, with their mental health. And then we'll speak a bit about COVID, how it relates to mental health, especially among children. And we'll wrap up by talking about some of our key messages, followed by a short question and answer period. So we are the Community Health Education for Refugees and Immigrants, or CHERI clinic. And our initiative was founded and is run by medical students at the University of Toronto. Our mission is to provide preventative health education and screening to newcomers in the Greater Toronto Area communities without health insurance particularly. And our long-term goal is of improving health literacy and health promoting behaviors in uninsured individuals and families. So you might be wondering, we know that today, for the most part, people in our audience are insured, and that's a benefit for us. So we have changed our presentation to make sure that it's applicable to you, but we just wanted to clarify that this is our broader aim and vision to support not only new immigrants and refugees, but also longstanding immigrants, children of immigrants, and everyone from our community. So in that spirit, we'll get started. But before we do, we just want to clarify that the information that we're presenting today is, of course, being presented by us, and we're medical students and not licensed medical professionals. So although we have consulted with several health professionals to make sure our presentation is providing you with accurate and current information, we really want you to seek the advice of a licensed healthcare provider if you're looking for information that's specific to your child, your family, or your personal context. Before we get started, we also really want to thank the Sringeri Vidya Bharati Foundation and the Ontario Konkani Association for this opportunity to speak in the first place, as well as the following individuals who are providing content expertise. So we have social workers, family doctors, a child psychiatrist, and a pediatric gastroenterologist who has helped us a little bit as well in terms of our content. And just wanted to give a bit of a shout out to my co-presenters today, Menur, Siobhan Wong, and Sugi Leonage, as well as myself. And we have other members of our CHERI team who have helped us put together this presentation, and you'll see around in our future presentations as well. So I'm just going to pass it over to my colleague Noor, just to take on the next set of our presentation.
Hi, everyone. My name is Noor, and thank you so much, Padma, for the introduction. So let's dive into it. What are kids exactly stressed about? But first, let's talk about the prevalence of mental health in children. So we have some stats here for you. About 1 in 5 children and youth in Ontario have a mental health challenge. And about 70% of mental health challenges actually begin in childhood and youth. It's really important to understand that a healthy mind is just as important as a healthy body. And in fact, the two affect each other significantly. Early identification of mental health problems in children can allow parents to support their children. And this really should be continued throughout their development and their life. We also want to emphasize here that families might feel that mental health challenges means very serious problems like psychosis or suicidality. But it is important to realize it can also include things like mood changes, anxiety, as well as OCD. Mental health challenges do not always appear in really obvious or extreme ways, and a lot of the times they can be very subtle. There's been considerable research done that has uncovered factors that predispose children to developing mental health issues. These are what we call risk factors. And on the next slide, we try to categorize risk factors into 3 broad categories here: family, environmental, and individual. We're going to start off with individual risk factors. So this includes poor overall health, so a sicker child, bullying, which is often seen in the context of schooling, significant life changes such as changing homes, changing schools, caregiver separation. So caregiver doesn't necessarily have to be parents. It can also be grandparents or an older sibling, a serious illness or death of a close relative or a family member, and loss of a friend group as well. Breaking up with your significant other, boyfriend or girlfriend, can cause a lot of stress to individuals. Questions about personal gender or sexual identity, facing or witnessing trauma and violence, and this could be at home as well as outside the home. Risky behaviors, including substance use. So substances are what we call alcohol, recreational drugs like marijuana, and smoking cigarettes. Lack of educational and work opportunities can also cause a lot of stress to youth, especially when they're finishing schooling like high school and post-secondary education, and they're wondering what's next. Feelings like they're disappointing the family and they're not living to expectations that others have of them can also be a significant stressor for children and youth. Our next category is environmental risk factors. And so this can include discrimination from peers, constant changes in residence or home, which can lead to a lack of familiarity, absence of a cultural community in a child's surroundings, and more recently, COVID-19, which we will touch more upon in the later slides. And the last category here is family factors. So this involves separation or rejection from family members, parental health concerns. So children are very impressionable. The health of their parents, which can be psychiatric or physical in nature, can affect their children a lot. So it's really important for parents to not only take care of their children, but also look after themselves as well. Financial stress affects parents directly, but that stress can also affect their children indirectly. And loss of a grandparent or caregiver can also cause a lot of stress for youth and children. So children are also exposed to factors that we consider protective. And what it means for something to be a protective factor is that it's associated with a lower likelihood of stress and mental health issues. And we've categorized them within the same categories as risk factors. So again, we're going to start off with individual protective factors. Consistency, change can be stressful for children. So changing homes and schools, like we mentioned earlier, can cause a lot of stress. A good self-esteem is very important. Thinking and processing information. So this means being able to reason, plan, problem solve, think abstractly, understand complex ideas, and learning from personal experience. It's really important to recognize that these are very age-specific skills and influenced by development. If parents do have concerns around these, it's never a bad idea to consult your doctor. A positive school environment and educational experience can have a huge impact. A strong connection to one's culture and heritage, being able to demonstrate empathy in social contexts, positive thinking and motivation, as well as good social skills. Environmental protective factors include support from friends, a positive and fun school environment, so including positivity and supportive connection from teachers and guidance counselors, interest and involvement in school activities, access to community support when needed, of course, and volunteering in one's community. Lastly, but not the least, we have family factors, and these are considered protective for children as well. This includes parental support throughout development, being connected with your family. Family also includes your siblings and your cousins, grandparents, anyone in your care circle. Parents' physical and mental health, once again, is very important. Regular communication with family, and especially when children move away from home for school or job opportunities. So children and youth face a multitude of stressors. There are global stressors to worry about, like the current pandemic. There's a climate crisis, and even racism can affect young children and youth. Learning about ongoing and harsh realities of our world can be very stressful, and this is true for all age groups. But for our purposes of this presentation, we're going to focus on common stressors. And we've tried categorizing them in easy and applicable categories. So we have school, family and friends, and home and health. So there's several school stressors, way more than this slide could capture. Some school stressors that your child may be experiencing can be related to exams, studying, deadlines, peer-to-peer competition, bad grades, bullying, sleep deprivation, separation anxiety from parents when children move away from home, pressure to succeed, and this could be a perceived pressure internally or a pressure that they're facing externally, constant worry about their future, and imposter syndrome, which is the feeling that you're not good enough in comparison to your peers. Children face a lot of stress from home as well. So this can look like family fights, parental anxieties, parental divorce or separation, and even the arrival of a new sibling can cause a lot of stress for children. Teens may feel that they've outgrown their home sometimes when they feel they're not being provided sufficient space or privacy issues, and this can lead to a desire for independence and conflict if parents don't agree with this. Friends and relationships in your child's life can also become a source of stress for them. This includes the pressure to fit in with their peers. This can lead to peer pressure and risk-taking behaviors, the ones we mentioned earlier, involving substance uses like alcohol, smoking, and marijuana. Children and youth can also experience mood changes from separation from their friends. This is especially relevant given the current circumstances of COVID-19 and the recommendations for social distancing. Other stressors for your youth involve a desire for greater independence and autonomy, like we touched on briefly earlier. Teen health is also impacted by their sexual identities. This can become very challenging for youth to accept if it conflicts with other parts of their identity. And currently with the digital era, it's how we portray ourselves on social media is also very important and considered a determinant of mental health, especially for children and youth. Finally, the last category I want to talk to you all about is health. So this is not limited to their personal health, but also the health of their parents, their family members, as well as other loved ones. Children can be impacted by short or long-term illnesses, which again can be their personal health or the health of someone they care about. Children may struggle with coping with the loss of a loved one, especially if this is their first encounter with death. It's important to ask your children how they feel when someone close to them passes away. Help them actualize and normalize these emotions. More recently, I think we can all say we've been impacted by the current COVID-19 pandemic. And we realize that our realities are shifting and we're trying to adjust to this new norm. At the same time, it's really important to check in with our children to see how they're adapting as well. And this leads us to our first question for the audience. What are some stressors in your children's lives that you've noticed? Feel free to use the chat box in the Zoom webinar. So we got a question earlier during the presentation that I can read out loud. What is the earliest age one can detect stress, depression, and anxiety in children, and how do you handle it? So that's actually going to be very thoroughly explored in our following slides. So we're going to leave that for the future speakers, if that's okay. And if it isn't addressed, we'll definitely come back to it. I'm going to hand off the webinar to my colleague now, Sugi.
And Sugi, just before you get started, I wanted to share that I'm getting some real-time feedback from family members watching that when you're watching with family, with the kids and the parents all in the room, children are pointing towards the screen and saying, this is what's stressing me out and this is what's stressing me out. So it's really nice to hear that some of us are really engaging and hopefully it's starting a conversation already in your families about stress and what's going on in your children's minds. But yes, so Sugi, if you could turn your video on, maybe we'll let you take the next part of the presentation and get started. If anyone has any other questions, feel free to add them in the chat. And we'll have another break and a question answer a few times before we get to the final question answer period at the end.
Thank you, Padma. So if we can go to the next slide. So now we are going to talk about how you can recognize if your child is feeling stressed or if they're having any mental health challenges. So when parents were surveyed to look at the common challenges that they face in recognizing mental health concerns in their child, these were some of the factors that were the most common problems. So one of them is it can be difficult to differentiate a normal up and down in their child's mood from something that's more serious, like depression. Another reason is that the child might be really good at hiding their feelings, so it can be hard to tell what's going on inside. A third can be, in some families, discussions about how you feel are not very common, and parents might feel unsure about how to even bring up this kind of discussion with their child. Another reason is that parents might not have enough time to spend with their child to be able to pick up on these subtle changes in mood or behavior. Another reason is that you may not be sure about what symptoms to look out for, and we hope that in this presentation you will have some more information about this. And finally, some parents say that it's difficult for them to tell when the child's way of thinking and dealing with stress is healthy or when it's unhealthy. So, for example, if some of your child's coping mechanisms are things that they have learned from their family and friends, it can be difficult to tell if this is what's normal or if there's healthier alternatives. So one message we want to give is that no child is alike. And this means that every child reacts to stress and expresses their emotions differently. And every child will have unique mechanisms to cope with stress, just like adults. So some of these mechanisms can be unhealthy or concerning, but many of them are normal and healthy. So the way that children demonstrate stress can be different based on how old they are, what their personality is like, and if they have physical or emotional manifestations. So we want to ask you another question, if you can comment in the Zoom chat or YouTube. So what are some ways that you express different emotions like sadness, worry, or stress? So I will keep going, and if we get any comments, we can read them out loud. So just like adults, children can show signs of mental stress through their thoughts, behaviors, feelings, and their physical health. So let's start with changes in thinking. This can include saying negative things about themselves, blaming themselves for situations that are outside of their control, frequently having negative thoughts, changes in their school performance like decreasing grades, and trouble concentrating, trouble with memory and decision making. The child might also express changes in the way they feel. So this can include reactions to situations that seem much bigger than the situation calls for. So for example, they may have frequent outbursts of anger. They might also be irritable, moody, and have mood swings. They may say that they feel unloved, and they may look very sad, worried, guilty, fearful, or angry. They may express feeling helpless, hopeless, lonely, or rejected. The child might have lost confidence in themselves, which is called low self-esteem. and they may be worrying about the future. You may also observe changes in the way that your child is behaving. So, learning to be alone is a healthy skill, but you might notice that your child is preferring to stay alone more often than usual, which is concerning. You may see that they're not caring about things that previously gave them joy, like their friendships, school, or activities. They may be having more conflicts with friends, and especially in younger children, you might see that they are clinging to a parent or teacher more than usual. You might see that they're more quiet than usual or less energetic. They may be sleeping too much or too little, eating too much or too little, dieting or exercising too much, and they might also be self-harming. So self-harming is a risky behavior, and it means hurting themselves without the intention of dying. So this can include things like cutting or scratching skin. And this can be a way that children are trying to deal with very uncomfortable feelings inside, and maybe a way that they're trying to get attention for their how they are feeling. And they may also be having risky behaviors such as smoking, drinking alcohol, or using drugs. So, like we said before, every child reacts to stress differently. So, some children bring their problems inside and close up, and they become more quiet and anxious. This is called internalizing. Some children bring their problems outside and they become more energetic and angry and active. And this is called externalizing. So both internalizing and externalizing behaviors can be equally concerning because they point to a child's mental health. So specifically with children who externalize, so children who become more angry or energetic, misbehavior can be a sign of mental stress. So I'm sure that for any parent, dealing with misbehavior is very overwhelming. So as parents, it's healthy to check in with how you are feeling and remember to take a pause if you feel angry. To deal with misbehavior, you can try speaking to the child to empathize with their frustrations, distracting the child with a different activity or a change of scene. And this is especially helpful with younger children. You can try giving timeouts and removing incentives like tablets or video games. So, especially in children who have special needs, using physical discipline can be very harmful and increase their stress. So finally, the mind and the body are strongly connected. So mental stress can affect the way we physically feel. Some physical children you might see in your children are, they may say that they feel sick. They might have headaches, tummy aches, neck pain, or general body aches and pains. They might feel nauseous, tired, feel dizzy, or have trouble with their sleeping and eating. They might be having regressive behaviors like bedwetting, or they might have too much energy or nervous habits like nail biting, hair twisting, and thumb sucking. So I hope that through these slides you can see how stress and mental health difficulties really affect any area of a child's life. And many of these are the same for adults. So to tie it all together, we want to share this helpful way of thinking about pain or suffering. So it shows that pain can have a physical, spiritual, social, and emotional aspect. And all of these aspects are equally important to consider and they interact with one another. So we would be interested to hear from you about if there's any symptoms that you heard now that you were surprised about were related to stress or any other thoughts you may have. Okay. And if there's no comments, I will move along to Padma for the next section.
Hi, everyone. Thank you. Sorry if you're hearing ambulance noises. Unfortunately, there are always medical emergencies. Hope everyone is okay. Sorry, was I muted that time? Hello?
No, you're fine.
Okay, great. Fantastic. So thank you, Sugi, for walking us through how to recognize signs of stress in that way. And I'm going to start talking to you all about as parents, how can you really support your children? So I think we've talked a lot about how you might identify if there are problems going on, things that we may not always have thought of to be related to stress. So for example, those physical manifestations that we were talking about, anything from sort of tummy aches to headaches, just about anything that's a physical symptom could also be a sign of worsening mental health or stress or anxiety or a number of different things. So we'll get started with the rest of the presentation talking about what you can actually do to help. So we know that every parent wishes to do the best for their child, and it's totally understandable that parents feel uncertain and overwhelmed sometimes about the best way that they can support their child through emotional challenges. Now we'll talk about what does it mean to form a secure patient-child attachment, and I'll talk about what that means. We'll go through some ways that you can support your children through stress, so things that you should do and maybe things that we might automatically do that maybe we should take a step back and think about not doing. Then we'll talk about some resources that might help you to manage your stress or to access supports to support your children through stress. And then, of course, we'll talk about when have you surpassed your capacity as a parent, when, in fact, the best thing that you can do to support your children is to actually seek some help for yourself or on their behalf. So I mentioned the term secure attachment. So what does that really mean? It's a secure attachment. It's referring to the deep relationship between a child and the people who provide most of their care. Usually that's their parents or caregiver. It could be grandparents or it could be a legal guardian. And this attachment happens really early from the time of infancy, and it continues throughout a child's development. So it's really critical because it's a foundation that lets your child explore the world, knowing that they have a safe place to come back to. As a child grows, a healthy attachment will help the child to deal with difficult situations like separating from you. For example, when it comes time for university, your child may have to leave home. So having a secure attachment might be helpful there. Cooperating with other children, building self-control, trusting other people, and being resilient. All of these are incredibly important to maintaining good mental health. So we know that we want a good and secure attachment between parent and children. So how is a secure attachment actually fostered? The key to doing that is to be present. And what does it mean to be present? So it means being sensitive, and it means being aware of how your child is doing and taking the time to pause and check in with your child. Second, it means once you know what is going on with your child, it means actually responding to it, and not just responding, not just reacting. There's a difference between reacting and responding. So in a secure attachment style, you want to respond appropriately to the child's needs. And we'll talk about what is the difference between reacting and responding in a second. The strategy as well that we want to talk to you about is listening really carefully to your child. So oftentimes in our culture, it's very common, especially based on how we were raised, how our parents were raised, how our grandparents were raised, that usually it's the parents or elders that set the rules of the house and everyone else follows it. Oftentimes there's no questions asked. There's not always room to create dialogue around how everyone is feeling or whether people would want things to be done differently. But one thing that's really important, regardless of what household rules might exist, is listening to your child, because this really gives you insight into how your child is feeling. So parents might feel that they're worried, they're missing something that's really important that's going on in their child life. Maybe you feel like your child isn't talking to you or your teenager isn't talking to you and you're really wondering what's going on. In those situations, it can be really simple to just listen if your child is already expressing that, or to ask. So young children in particular, they might express their stress throughout play or use bad behavior or to use as a way to get their parents' attention. So I'm not sure if you've seen TV dramas. I know in Criminal Minds, not to pull in some negative stereotypes, but sometimes you might see when a child has really gone through a traumatic experience, you might even see it in their drawings. You might even hear it from the teacher in class about what your child might be saying. It's a normal art class or they're playing, and it comes out in more subtle ways. So even observing and paying attention to things that you might not be expecting might be a good way to be listening, or another way to be listening and observing. So if we listen and observe carefully, children at any age, even babies and toddlers, can in some way articulate or demonstrate how they're feeling. Any symptom that a child has, whether it's mental or physical, is real and valid. So that's another thing that we really wanted to get across. It's really helpful to always validate that your child or teenager or your youth, their symptoms are always real. So just because they might be feeling worried or anxious or sad, or you might think it's all in your head, that might be the case. A lot of what we experience is through our head. Even the physical pain that we're experiencing when we break our leg is through our head. But that doesn't make it any less real. So really explaining that it's okay to feel these things and it's normal, and providing space for allowing them to feel their feelings in the first place. So encouraging them to accept the feelings, discuss the feelings instead of hiding or ignoring them is really important. Just like we do as adults, children at any age appreciate having the opportunity to express their ideas and to have their ideas be respected and acknowledged. So how do you actually do that? That might seem really confusing, but these are some examples of open-ended questions that you can ask your child to start an open and trusting dialogue. So if you're noticing something or you're curious, you can start with something like, what's going on? It can be as open as that. If you notice that if your child has come to you and says, I'm really stressed about school, you can ask, why do you feel that way? How do you think you might feel better? So oftentimes children or youth may have an idea already about what they might need to feel better, what they want to do to feel better. And it opens the conversation for them to talk about their expectations for themselves, maybe what they are thinking are your expectations for them. So using these open-ended questions can be really helpful in that way. Another big one is, what are you scared of? So asking your child that directly can be really, really powerful. As we talked about in other parts of our presentation, especially in our community where oftentimes our parents or grandparents have traveled a long way, have gone through a lot of hardships that maybe we haven't personally experienced. And we know we are really grateful to have our parents have sacrificed so much for us to be here. Underlying that though, underlying all the gratitude might also be a sense of guilt, or a sense that you need to perform at a particular level, or expectations that you need to make your parents proud because of what they went through, that you need to be successful or else everything they did wasn't worth it. So really digging in and asking some of these questions can be fundamental to opening up that dialogue and making sure that you're understanding what's going on in your child's mind, because you might not think you're saying something directly. You might feel you're not putting any pressure at all, but they might be feeling it anyway. And it may not be coming from you. It may even be coming from school. It may be coming from their friends. So asking these open-ended questions can be really helpful. And finally, one that's really, really important, I think, is asking your child, how can I help you? So oftentimes what we see with parents is, of course, you love your children, you want to help. And oftentimes the first thing you want to do is offer suggestions. You have an idea of, you know what, I know you're feeling sad. I know what's going to make you feel better. Just wake up every day at this time, have a routine, eat the right food, exercise. You might have these ideas on an advice that you want to pass with your child that might be incredibly important, but your child has to be in the right space to hear that. Or it has to be the type of advice that your child is open to listening to and ready to act on. And that's not always the case. And this isn't just specific to children. This might be with your colleagues too. Think about if you're going to work, your coworker says they're feeling upset, you're not going to tell them to go for a run. So just think a little bit about creating some of that space and asking your child how you can help them. And chances are they'll tell you. Maybe they want a hug. Maybe they want you to tell them you're proud of them. So it can really vary, and asking them about that can be helpful. So just to summarize that aspect, parents naturally want to help their children solve their problems. They want to get rid of the problems. They don't want any problems in their children's life. But it can be just as important to not always try to solve the problem and just listen to your child. Even holding that space and allowing them to talk to you is therapeutic, and it is helping them. This encourages the child to be self-sufficient learns, and they can learn to accept their own feelings and also cope with their feelings, especially in the moments that maybe they can't reach you. Third, we want to talk about fostering self-esteem. So a child with good self-esteem has a positive outlook on life. They'll accept themselves and feel more confident. So this helps them to form healthy relationships, make healthy decisions, do well in school and in social situations, and feel confident saying no in dangerous situations or saying no in general. So ways to foster some of these self-esteem can include showing love and acceptance. So we know that our parents care about us and they love us, but sometimes different parents have different ways of expressing that. So it might be helpful as parents to think, or grandparents to think about, how is it that you're showing your love and acceptance to your child? Are you verbalizing it? Are you saying I love you every day? I'm not saying you have to, and maybe every child doesn't want that. But maybe your child might want you to show physical signs of affection. So maybe a kiss on the cheek, maybe a hug. Maybe your child doesn't like those things and would prefer that something like acts of service. So maybe the simple act of you dropping them off somewhere makes them feel really loved and accepted. Maybe the act of chopping up some fruit and bringing it to their table when they're studying, that can be something that makes children or youth, especially teenagers, feel really loved if they don't have to think about that additional aspect, and just it's something that youth often talk about that their parents might do, and it makes them feel good. Another way to foster that self-esteem is to focus on your child. So we've talked about observing, so I won't belabor that fact. Another thing that's helpful is a consistent structure and rules that are appropriate for the child's age and developmental stage, because it helps them feel safe and it builds their decision-making skills for later on. Of course, positive reinforcement is really important. If you notice them doing something good, I would compliment them. Let them know that it is something good, a positive behavior that they should keep doing. And oftentimes you want to give genuine praise. So if you're really proud of them or if they've done something important, let them know, and don't be, try to be as explicit as possible. You know, we can be really generous with our compliments. We don't have to be stingy with those. We want to also make sure that parents are good role models for having a good self-esteem. So something that we know all the time is children and youth often look to their parents from the very beginning, since childhood, about how are my parents reacting to this? How did they deal with their stress? What's bothering them in their lives? Do they like their relationship with themselves? So we're constantly absorbing things from our immediate surroundings, whoever's living in the house, whether it's parents, grandparents. So just be mindful of your own self-esteem and how that can affect your child. Another thing that helps self-esteem is to help them learn from their mistakes. So if they've made a mistake, try not to critique the child themselves or their personality. Try to critique the actual behavior. Explain to them why it's not something that should be repeated and why it might be unsafe, and really give them the supports to make sure that they don't repeat it next time, as opposed to criticizing your child as a person. Give your child opportunities to contribute at home. Make them feel important. Offer them choices and give them the chance to problem solve. As we mentioned earlier, a lot of problems that children and youth are dealing with, they might have their own ideas on how they might want help. So ask them and help them problem solve through their own problems. And finally, encourage accepting emotions. It's really normal to feel any way that someone wants. How can we continue to function effectively in spite of our fears and anxieties is the question. So something that's also common in our community is we don't like seeing people cry. We encourage people not to cry, or ask them to stop crying if they are. But in actuality, if someone's feeling sad, crying can be so cathartic. It can be incredibly helpful. And once they've cried, once they've gotten it out, everyone has different ways of relieving that stress, and crying can be one of them. So try to provide that space. If it is crying and your child is crying, let them cry, and provide that safe space with them. Maybe sit with them, give them some silence, and wait till they're finished crying, or tell them you love them. All of that can be really helpful in that moment that your child is feeling stressed. Fourth, a safe and positive home environment can also help your child to be emotionally strong. So something that's important about this, and one of my colleagues touched on this earlier, we're living in a digital age. So you need to be careful about what your child or youth is consuming on the media front. So what is your child watching? both the types of content that they're watching and the amount of time that they're spending on screen. So this is really common with young kids. Parents want a break. Of course, understandably, they've spent the whole day, cooking, cleaning, playing with their child. They just need an honest break because parenting is tough work. They might turn on the iPad and let their child watch a couple of videos before on their own and give themselves a little bit of break. But by the time you come back, you might notice your child isn't watching the types of videos that you put on for them. Some of our algorithms really take them different ways, and you have no idea what your child has consumed. And sometimes based on what it is, it can be really stressful. So just checking in with your child, making sure that the content they're looking at made sense to them. Was there anything that worried them? And always offering that opportunity to speak with them if that's what they want. So try to also be sensitive when you're discussing serious family issues like finances or marital problems around your children. So this might be a common conversation with your spouse or your other family members, extended family members, that might happen in the kitchen or other common areas of the house. But be mindful if your children are watching. If there's yelling in the house, or if there's some serious family issues and stressors that you're talking about openly, if your child does hear them, try to take the opportunity to debrief it with them. Maybe ask them how they felt about that. Reassure them if there's nothing really stressful going on, and let them know that no matter what, they will be safe and protected. Another big thing is to provide time for physical activity and play and family activities. So if there's anything you like to do for fun, definitely include that. And the more that you do activities together that are positive and you all enjoy together, it really solidifies the family bond, as you all probably know. And the most important thing here is to be a really good role model. So take the time to look after your own mental health and well-being and happiness. Take care of your own mental health, speak about how you feel, take time to do the things you enjoy, because everything you do, as stressful as it might sound, your children and youth are watching. So what you model is likely what they're going to pick up. And if what you're modeling isn't helpful and isn't a good coping strategy, then your children will take that on and will have to seek other supports to unlearn that. So in terms of immediate strategies, so what can you actually do when you're helping your distressed child? Number one, don't panic. The first thing that you can do, that you might want to do, is when your child is panicking, maybe throwing a tantrum, or is maybe really upset, they might be crying. The first thing you don't want to do as the person responding to that is panicking. So panicking is an example of what might be a reaction. So if your child is crying and you're feeling panicked, you don't know what to do, you might respond by yelling. You might respond, stop crying, right? That's what you might react in that way. Or you might say, nothing is going on, everything's going to be okay, stop crying. So there's a lot of different ways to give that same message, but that would still be a form of reacting. A way of responding in that moment might be waiting, listening, allowing them to cry a little bit, letting them know that, you know what, I don't know what's going on right now in your mind, but I'm here if you want to talk. Don't worry, take your time. I'm going to be here and we're going to get through this together. So that can be an example of responding as opposed to reacting. As a part of that is making sure that you maintain a supportive and calm environment. So if children can sense your anxiety and stress, it's just going to further heighten their own stress and anxiety. So some experts even suggest maybe playing some music in the background to help calm down your child. You might want to practice deep breathing exercises with your child. So for young children, you can encourage them to use their imagination for breathing exercises, like smell the flowers with inhale, and blow out the candles and exhale like a birthday cake. So this is really simple for young children. Another thing that you can look up that if you want to do as a family activity, which I might recommend for your Sunday night, is to look up mindfulness exercises. So there are many of them that are really exciting, everything from a mind-body scan to imagining, closing your eyes, thinking about the last family trip you took to a national park, and really grounding yourself in that moment. All of those things can be really good for stress reduction. Another thing in the moment is counting maybe 1 to 10 to help ease the situation, give everyone a bit of space. We're talking about this, you can give your child 10 seconds to calm down, but maybe this is also a strategy used towards yourself. So if you're noticing your child is misbehaving or acting, maybe you want to take 10 seconds to react, collect your thoughts, collect your feelings, and then think about how you really want to respond to your child to be in the most supportive way. Try to provide them with a lot of reassurance. Sometimes your children might need physical affection, like a big hug. You can distract them from the source of the stress by going for a walk, engaging them in an activity or a toy that they like to play with. And sometimes for children and teens especially, maybe they want some space and privacy. And that's okay. that isn't a reflection about what type of parent you are. It might be a normal way that they're responding to the stress that they're feeling or the anxiety that they're feeling. So if they need, 15 minutes, an hour to themselves to calm down, let them have that, and let them know that you will always be there when they're back, and you'll be ready to talk to them whenever they're ready. So we just wanted to ask, are there any activities that you enjoy doing with your family? Feel free to share them in the chat as we go along. So I'm just going to check if anyone's responding. Walks. Okay, we have some walks. That's really great. I know the summer was really hard to go with families on physically distant walks and maybe go camping, but walks are really exciting, getting some fresh air and that physical exercise, going on drives. That's going to be beautiful in the fall as well. Hopefully you and your family get a chance to go out on those drives. So that's really exciting. We have board games. That's really great. Cooking with children. I haven't seen that too much, but that sounds like an amazing activity. Maybe if you have a chance to go apple picking or something as a family, bake something together, that can be really exciting. Get the children involved. We have going to the playground. That's also wonderful. So I've seen some children playing at the playground, and that's really nice to see, because for such a long time, we weren't seeing anyone outside. So it was a really pleasant sight to see. So these are some great suggestions for what to do with your family. And hopefully you have some immediate tools now to work with on if your child is feeling stressed in the moment, how you might respond. And if you're stressed by your child's being stressed, then how you're going to check in with yourself before you respond. So let's take a couple of minutes to just watch a video by the Canadian Pediatric Society on how to promote positive mental health, and then we'll come back. Feel free to continue to use the chat box if you have any questions or answers to any of the questions we asked.
Promoting a child's mental health is a really key, important part of promoting their overall health and well-being. A child's mental health affects how they interact with the world, how they see themselves in the world, and ultimately also affects their physical health as well. So when caring for a child, it's important to not only nurture and look after their physical health, but also to look after their mental health as well. You got to start with how they think about themselves. And so working on a child's mental health, and in particular, if your child is not feeling happy, or they feel a bit downtrodden, they feel not confident about themselves, or they have significant anxiety issues, they're not going to take good care of themselves. The environment, such as having people to talk to. So if you open a dialogue with your child and really encourage them to express their feelings about what they're thinking, about how they feel when something happens to them, either good or bad, they feel they can open up to you, and that provides an exceptional environment for them to develop their mental health.
The home environment is key and critical, and can involve such basic things as being a home environment where a child feels safe, where they feel loved, where they feel nurtured, where they're not exposed to violence, where they have food, healthy food, a chance to rest, a chance to play, a chance to sleep. It also involves setting limits as well, teaching your kids right from wrong, rewarding them when they do things well, but also providing consequences when they don't do things that are appropriate as well.
I think there's something to be said about sort of voicing or speaking to each other between child and parent about what their expectations are and making them realistic. So when either a parent or a child has unrealistic expectations for themselves or for each other, that can lead to stress. Every day, they're stretching themselves an extra couple hours with activities. And depending on what kind of personality they have, they may have very strong expectations like, oh, I have to perform really well at the soccer game. I hope I get first in the piano competition. And all these things can add to a lot of stress. We actually make our kids do a lot of things. And some of those things may or may not be as important to them.
I think children really respond well to routine and structure. And so having a predictable home routine with regular meals, regular snacks, regular bedtime. These are all things that really children respond well to and promote good habits and good mental health.
If you create an environment at home where you're always talking about these things, you're encouraging them to express themselves, then that sort of obstacle between you and your child is not there. So they feel very open with you. And that kind of environment is really, really helpful for a child.
So we hope that was a helpful video for you. I just wanted to shout out this amazing resource called caringforkids.cps.ca by the Canadian Pediatric Society. So a lot of the content that we talked about today, especially if you forget what we said, hopefully you don't, you can visit on a website and see some of these strategies. And it has a lot of different domains, not just physical, not just mental health. Even if you're worried about, for example, should you go to the emergency department? My child has a fever, or what to feed your child. And it has even suggested diets. There's a lot of different resources there that can be really helpful. So we just wanted to also show you, sorry, just give me one quick second. Just want to confirm you're able to see the slides. So you're not, okay. Okay, great. Are you able to see it? Yeah, okay, great. Okay, I think I changed something again and you're not able to see it. Is this okay right now? Is everyone able to see the slides? Okay. So sometimes, no matter how much you do as parents, and this might depend on home environment. We talked about so many different types of stressors that can come in a parent's life. Sometimes you need to make time to seek help from professionals. So sometimes when your parenting strategies have reached your limits, and sometimes they do, it shouldn't be an embarrassing thing to ask for help, because honestly, we could all use it. Even when we think we don't need it, there's a chance we might be able to use it. So some children and families may experience challenges when they reach out for this support. So some of these challenges can include the fact that maybe you worry that a mental health diagnosis might bring shame to the child or the family, or more than maybe shame to the child, something that parents might be feeling is, do you feel guilty or like you've let down your child because they're feeling sad or upset or worried? So that's one thing to check yourself. So just wanted to address that. Just because your child is feeling upset or worried, there is a chance that it's not about you and it's not about your parenting style. And there's a chance you've done everything right or the best that you can, and still your child is upset. So try not to take that personally, and try to shift that into a lens of how can I help my child now that they're experiencing this, now that they're feeling this way. What is the best that I can do now? And sometimes that might involve, like the strategies we talked about earlier, opening up a dialogue, or that might involve actually taking them to see the doctor, encouraging them to see the doctor on their own, depending on how old they are. The other worry that people might have is that a mental health diagnosis might limit achievement in some way. Maybe once you have the diagnosis, it might mean, it might make it more real. Feel like maybe your child won't be doing well in school, or might hurt them in terms of getting a job or finding a good marriage partner or in their relationships. And then sometimes we might also worry that a diagnosis might lead to rejection in the community. So there are some mental health diagnoses that might be more normalized. Some things which, even though they are more normal, are still quite stigmatized, as we know about in terms of mental health. But then there are certain diagnoses that are perhaps even more stigmatized in that range. So depending on what it is, people might be scared about that too. There might be additional fears about seeking mental health care in Canada. So will the care be culturally appropriate? Are you going to go and get a doctor talking about, you should do this and that, and none of that is compatible with our values or our culture? So that might be a worry that you have. And just to address that, there are definitely culturally sensitive mental health practitioners that you can find. But even the good ones, the ones who are trained, should be able to cater their feedback to you to make sure that it suits your context, including your culture, including your personal values and all of that. Another question people have is, will it even be effective? So let's say you reached out for help. Let's say you signed up to go to therapy, or your child did. How do you know it's going to work? How do you know it'll be effective? This is a question that really comes up on people's minds when we're thinking about medications. So sometimes we're okay to admit that, okay, my child is feeling bad. Okay, they're talking to someone about it. But sometimes it takes that additional jump, that additional leap that, oh my God, my child has to take medications for this thing. Is it really that bad? Have I failed them that much? So we need to get over that way of thinking too. Just because We want to clarify that mental illness, it is in our brain, and our brain is a real thing. And there are changes in our brain that that take place when we have a mental illness, for example, or a diagnosis in that way. And you really need a drug to treat that. And in those cases, a medication can be one of the best ways, the most helpful ways to feel better with that diagnosis. So trying to work on that stigma of medication can be really helpful as well from your end, in case that's something that your child might need along with therapy. So there's also an uncertainty about what mental health care can look like. So let's say you reach out for help. What is it going to be like? Am I going to sit on a couch, have to analyze some, look at some pictures, and I'll say some words or associations that come to mind, and then quickly they'll just know what's wrong with me and make all these assumptions about you. So usually based on what you might have read in books or seen on TV shows, people have these ideas about what mental health care actually looks like. But in reality, especially in COVID times, what it looks like is a Zoom call every 2 weeks with someone who looks like a school guidance counselor, maybe a doctor, who's just amazing at listening and teaching you a few helpful mind hacks or tricks that lets you think about things in a healthier way. So they might notice as you're talking that you are always thinking about worst case scenario. So then in that case, they might help you think about what is a way you can think about the fact that maybe the worst case scenario might not happen. What is the best case scenario? And is there a way you might focus on the best case scenario and try to hope for that to happen instead of working on the worst case scenario? So there's a lot of different options in the ways that we're thinking and patterns in our thinking that mental health experts can really help us with when it comes to therapy. So it's really important to acknowledge these fears. And we're lucky that we're living in a time where the stigma of mental health is decreasing a little bit and individuals are having more open conversations about mental health. But at the same time, many communities have their own mental health services that can also provide that culturally appropriate care. So here's some resources that you and your child can use. Sorry, I don't know if you're able to see this. Yeah, so here's some resources that you and your child can use. First of all, there's some online resources and apps that you and your child can use to build some of those skills to cope. There's some breathing exercises and mindfulness activities I spoke about earlier. There's also some community resources. Some of them are free and they don't even need an OHIP card. And then if you live at all in the Peel District School Board or in the Peel region, they also have a document with additional resources that are found in the Peel community. So these are the ones I was talking about. Sorry, just if you want to jot down some names. And of course, this will be available online as well if you ever want to refer back. And then we'll also have one of our team members share some of these links in our chat. And then there's here also some websites that you can look at. They are developed from a Canadian context, but if you're watching from anywhere else, it is applicable to children, I would say almost anywhere. So feel free to check them out and they might still be useful to you. And the last thing I really wanted us to talk about is now that we've talked about how you can support your children at home, and then if you need external resources and you have the time to take advantage of them, then using those, you might still be asking, when is the right time to see a doctor? So when is the problems important enough or progressed enough that you need to seek additional or outside help? So the first thing is, if you have any concerns about your child's safety at all, don't hesitate to seek any medical support. So this can go from anything from going to the emergency department if you're really worried, or if it can wait one more day and reaching out to your family doctor to book an appointment, please do that as well. This can be anything like if your child starts to speak about things like suicide, wanting to end their lives or not be alive anymore. If they're talking or you're noticing that they're hurting themselves in some way or neglecting their well-being in a significant way that's really different from before. If they're talking about hurting other people, then that's something to keep an eye out for as well. Another big sort of clue in or a red flag is whatever previous coping strategies that your child or teenager might have been using. If it doesn't seem to be working anymore, that's another sign. So if their function in some way is being affected by how they're feeling, that's another big clue that something needs to change and some additional help is needed. So this function can include how a child loves or works or plays, if there's problems in school or employment or with their friends, relationships in their life, in terms of how they act in the home environment and a number of different things. And then, of course, it's also concerning if the symptoms last for several weeks or more. You might also notice that if your child keeps mentioning the same worry, and it's hard to distract them from this worry, then that might be another sign that something is a problem. So this is what we call rumination. So if they're really worried about their weight or what they're eating all the time, if their sleep is disturbed, all of these are signs that maybe you might want to include someone else, contact your doctor, a mental health professional, and just make sure that you're provide the best thing you can do in that situation as a parent is to make sure you're accessing those resources for your child. But the main message we want to provide is that if you have any concerns or uncertainty about your child's well-being or development, it's never wrong or never too early to reach out for help from your family doctor, your pediatrician, your emergency room, or another healthcare provider. No problem is too small. Sometimes, even if you don't want to bring your child, booking a doctor's appointment for yourself to talk to your doctor about how to talk to your child, even that can be really helpful because they can give you strategies on how to work with your child for your specific context. And it's important to remember that your worry and how you respond to your child really does impact your child, their stress, and how they're dealing with that independent issue. So now I'm going to pass it over to my colleague Siobhan just to talk about a brief introduction to COVID in relation to children and mental health. But please keep the questions coming and we'll address them in the Q&A. Thank you.
All right, so good morning, everyone. So as Padma mentioned, we're going to switch gears a little bit for the last section of our presentation to talk about COVID-19. So we're currently living through one of the most stressful periods in history, and this is having an impact on both our physical and mental health. So many parents, including many of you in the audience today, still have questions and concerns about how to discuss the COVID-19 pandemic with your children. So in the next couple of slides, we hope to provide you with some tips about talking about COVID in an age-appropriate way with your child, as well as tips for supporting their mental health. So in addition to the physical impact of COVID-19 on our health, the pandemic has also brought on new challenges, which has had an impact on our mental well-being. So 64% of youth aged 15 to 24 have reported a negative impact of the pandemic on their mental well-being. And out of this age group, it has been young adults and post-secondary students that have been most affected. So why has the pandemic increased stress and anxiety for children and youth? So firstly, there's this general fear about getting sick. But moreover, children and youth are worried about the health of their loved ones, like their parents and grandparents. We're also constantly being bombarded with new information on the news and social media. With this massive amount of information that we're receiving, it can be very overwhelming, and this can lead to stress. Physical distancing from friends and loved ones has also fueled social isolation and loneliness that many youth and children are feeling. There's also so much uncertainty with this new normal and what this means for the future. And in particular, for young children, this constant change in routine, mask wearing, rules about what's safe to touch and not, has also been very unsettling, and this can lead to stress. For young adults, moving back home can be very stressful. Here they may experience a lack of privacy, a lack of independence, which may increase family tensions and lead to stress and anxiety. For post-secondary students in particular, they're facing increased stress and anxiety due to financial stressors. And with the downturn of the economy, there's currently less career opportunities for them at the moment. So how do we start a discussion about COVID with children? Oh, can you move to the next slide? So a good way to start may be to ask what they've heard about COVID. So for example, you can start the discussion with, we've been hearing and seeing a lot about COVID-19 on the TV lately. What have you heard about it? When you're explaining and answering their questions, you want to keep your message simple and use easy to understand language. It may be helpful on your part as the parent to do some research beforehand to make sure that you're well equipped to answer their questions. Next, you want to check in with how this information is making them feel. What are their concerns? What are their worries? You also want to emphasize what you and your family are doing to keep your child safe. So for example, why you're wearing masks and that you're washing hands more often. Finally, you want to reassure them that there are a lot of amazing people like doctors, nurses, and scientists that are working really hard to keep us all safe and healthy. So for young children, Your discussion should cover the basics like what, who, and how. Next slide. So for the what section, you can say something like, COVID-19 is a tiny germ that makes some people sick. Some people that get sick may have cough, they have a sore throat, or a fever. In terms of the who, you can explain that anyone can get sick from COVID, especially older people, but very, very few kids get sick from COVID. As for how the germ is spread, you can explain that people get COVID when the germ is on their hands and they touch their mouth, their nose, and their eyes. That's why it's important that we wash our hands often. People can also get it if someone sneezes or coughs close by, and that's why we wear masks and keep 6 feet apart from people. So for older children and teenagers, they may be already well informed about COVID from what they've seen in the news and from social media. But this doesn't mean that they don't have questions or want to discuss it with you. So if this is the case, it's still helpful to have these discussions with them and answer any remaining questions that they may have. For this age group, it is particularly important to acknowledge and listen to their fears, worries, anxieties, and frustrations. Sometimes teens just need a safe person to vent to. You also want to emphasize and encourage following public health guidelines like physical distancing, wearing a mask, and frequent hand washing. And you also want to seek out reliable sources of information with them. Being a role model for your children and teens is also highly recommended. So during this stressful time, here are some ways that you can support mental wellness for your children and teens. First, you might want to limit the TV and social media exposure that they get. Again, this can help reduce your child's feeling of being overwhelmed. It might also be helpful if you and your child spend some time together finding credible sources of information. Second, maintain a routine as much as possible. This will reinforce a sense of normalcy and structure for your child. You also want to use this opportunity of staying at home and being in your bubble for family time and family activities. This will help curb the feeling of isolation. Maintaining a healthy diet, exercise, and sleep schedule is also key to mental health. As we discussed before, physical and mental health are very closely connected. Lastly, physical distancing does not mean social isolation. So maintaining those virtual connections with friends and loved ones, especially like grandparents, is key to maintaining that sense of social connectedness. Next slide. Okay, so we know that we may have presented you with a lot of information this morning. Our hope is that this webinar has provided you with some tips and strategies to start discussing mental health and mental well-being with your children, teenagers, and young adults. So from our presentation today, we have 4 key messages that we hope you will leave this presentation with. First is that children and youth of any age are unique, and as such, they can articulate their feelings and emotion in their own unique way. Secondly, any symptom that your child may have is a valid symptom, whether or not it's something physical, like pain, or something emotional, like stress or anxiety. Thirdly, children appreciate open dialogue and a listening ear. Spending quality time with your children and listening to what they have to say is important to their well-being. And our most important message for today is to not hesitate to seek out healthcare advice from your doctor or any other licensed healthcare professional if you are ever uncertain or concerned about your child.
Perfect. So thanks everyone. So that concludes our sort of pre-prepared video for you today. We know that there are some questions already in the chat, and we had some pre-prepared just in case you were curious about them, but we'll save them for the end if we have some time and if you're curious. But I just wanted to, first of all, thank you for listening and also open it up to Dr. Pai who is an incredible pediatric gastroenterologist from McMaster University, who has graciously offered to support us in the question and answer period, because we're seeing some great questions here. And I just want to ask him to add any thoughts that he might have, any particular takeaways that we haven't already covered with his expert advice he already gave us. And if he wants to maybe answer the questions around medication dependency, as well as back to school and COVID, in relation to class sizes and stress related to that.
Sure, Padma. Thanks so much. Thanks to your team as well. This is a fantastic presentation. I apologize for my background. I'm trying to hide from my 2-year-old who might burst in the room at any moment. So a little bit of an atypical setup today. So I'm a pediatric gastroenterologist at McMaster Children's Hospital, as Padma had mentioned. So over the past several weeks, and indeed over the past few months, through many of our telemedicine visits, this has been a very, very common topic, and we've been seeing it in our children of all age groups, right from the toddlers up until adolescents, that COVID has had a huge impact on really bringing the topic of mental health concerns in children and adolescents really to the forefront. So there's a lot of things to say, and I think I should also just preface any comments that I make that there are also many different opinions and thoughts amongst the medical community. And I think maybe as one proviso to anything that I say, even amongst physicians as well. So within McMaster Children's Hospital and all of our Ontario affiliate hospitals, Children's Hospital of Eastern Ontario, CHEO, London Health Sciences Centre, and Sick Kids, there's been a concerted effort to try and have very similar statements that have been coming out provincially. A lot of the thoughts around COVID-19 and guidance have to do with a few realities right now. One is our current Ontario prevalence rates. So when we see what some of the risks are like just for our children and our youth, they have a lot to do with what the rates of community prevalence are and how that will impact what's happening in the schools and what is brought from the schools back to the homes. So a lot of this data is shifting, but decisions are made as best we can based on what we have right now. I think the other thing, though, is even amongst the medical community, some of the difference of opinion has a lot to do with just the volume of information and data that we're all receiving. So I think a very important comment is, irrespective of what I say or your family doctor, there are certain individual factors that relate to your family and your child. But moreover, for general statements, we must look to public health, because they're really the ones who are on the pulse of what is the most current data available to try and give community guidance. So I guess with those really important caveats, I'd be happy to try and answer some questions. Maybe Padma, if you wanted to help moderate, what are the questions coming in the chat window?
Absolutely. So just taking a look at the chat, I know we started to address some of the questions. Maybe we can answer the question about a perception that taking medication, I'm assuming these mean mainly psychiatric medications, maybe antidepressants or anti-anxiety meds, but perhaps they could also include long-term chronic medications, I guess in the context of children, whether the individual will become dependent on it or if that's a myth. So kind of talking about the worries about starting things that maybe need to be weaned off, or people are worried maybe about side effects or what it might mean to have to be on a medication for life.
Yeah, great question. Okay, so maybe let's talk about psychiatric medications. Maybe one common one would be mood stabilizers, for instance, things like SSRIs, things that we like Prozac, for instance, is a common one that's often described. So it's a tricky answer. So I'll say not likely to cause any dependence. And I say that based on the abundance of literature that has been produced and published on this topic. As we know, mood stabilizers are one of the more commonly prescribed medications. And the value of that is we have lots of data from which we can work off of. Having said that, though, the literature does describe that there might be some presumed side effects and potential short-term withdrawal that can occur when an individual comes off of those medications. And once again, it's very highly dependent on an individual, but potentially after long periods of use, there can be some short-term withdrawal symptoms. The challenge, though, and we can appreciate this as trying to be critical consumers of the data we're reading, you can imagine that in doing a study like this, it's very difficult to tease out whether the dependence that might be described or misdescribed in some studies on a medication that stabilizes one mood may actually have to do with the fact that that individual indeed continues to need that medication in order to feel more positive and retain a sense of quality of life. So this is one of the challenges in the literature. There are also, though, other populations for which there are reasons to at least have a discussion with your doctor in pregnancy, during times of breastfeeding, after long periods of use, and certainly a discussion that always must occur with a good family doctor or a good psychiatrist about whether there can be scheduled periods of time when a drug holiday can be trialed. Making sure that the dose that is being given is the lowest required dose in order to still maintain excellent function and not have symptoms. I think the other quick comment on that is all of these medications certainly do need to be used adjunctively. So what we mean by that, very much like Padma and your team had said already, cognitive behavioral therapy, counseling, these all come hand in hand along with the use of medications. But certainly this fear of what medications do and long-term side effects, I also would reinforce, is not a reason for us to shy away from them. Like any disease or illness that we struggle with, medication therapy certainly has a role in mental health, as well as some of the other strategies that are used alongside. Let me know if I can answer that in more detail, but hopefully that provides some general comments.
Wonderful. No, that was extremely helpful. If the person who asked that question has follow-up questions, feel free to ask them more. But I was wondering if you could elaborate on when the medical world uses words like withdrawal. I think in public, there's sort of a different perception of what that means, or the seriousness is maybe taken, the weight of that is taken differently. So I was wondering if you could maybe even if it's okay, talk about, for example, what that withdrawal might look like, or the conversation of weighing risks and benefits of starting a medication or continuing a medication that you can have with your provider.
Yeah, maybe we'll start with that. The second part of that comment you asked for, Padma. I think when we talk about the risks and benefits of starting a medication, certainly this is the case in my practice, regardless of what I'm prescribing, whether it's a mood stabilizer for a patient having mental health issues, or more commonly for me, a patient who has something like Crohn's disease or ulcerative colitis, and we need to start them on therapy. The real question we always have to say is, any medication, of course, is one that we would rather do without. Everything obviously has side effects. But what I often try and talk to my patients about is the risks of not doing something also has significant side effects as well. If you are struggling, and in topic at hand right now, you have explored other options. You have found counseling services. You have trusted people whom you can speak to, and people who are skilled to try and work through other non-pharmacologic strategies, but you're still struggling. That is an enormous side effect on your family, on your ability to function as a student, on your ability to retain a social circle and be a contributor in your household, many things. And I think we all owe it to ourselves to say, well, is it now time to say that I need some additional help beyond what I can currently do? In terms of the medications, all of them are quite different. It's hard to provide one constant message on this, and it also certainly depends on differences in dose. The way that medications work in the mental health world is that we see that in certain patients, you either have a decrease in the amount of neurotransmitters that are required in order to keep you functioning well, or you have too much of those things. And all the medications do is bring things back down to normal levels. Now, what is sometimes worried about is, after coming off of that medication, if it was something that was helping to boost the amount of neurotransmitters, such as serotonin, which is commonly described, in order to make you feel like you're functioning optimally, what happens when that medication suddenly goes away? There is some literature to suggest that potentially you will have a brief period where your body is starting to acclimate again to not being on the medication, that the neurotransmitter levels may vary. But again, these are generally very brief. And perhaps moreover, in saying, well, is there a reason that the medication has caused me to drop back down to lower levels than I would like? The age-old question is that the reason why you needed to be on the medication in the first place? And all of these things can be explored a bit further. In terms of what those withdrawal side effects may be, again, a little bit hard to answer in summary, but sometimes those are the same pre-existing symptoms that one had before they started the medication. Not always, though. And certainly, in many patients who have taken their medication alongside learning great strategies to try and deal with their symptoms, they're able to counteract that by using their behavioral therapy techniques, the assistance of a counselor, and other services alongside.
Absolutely. I think hopefully we can get through at least 2 more questions before we get to the thanks. One of them, I thought the audience could really benefit from you as a gastroenterologist speaking about, in terms of the cases that you see in patients, young patients presenting with GI issues, what percentage of them is mental health related? We touched a little bit about physical manifestations of mental health, but what percentage is related to mental health, do you think? What's the connection there?
Yeah, sure. Great question, Padma. I'm going to try and be very succinct because I want to get through more questions. There's this term called functional GI symptoms, and functional symptoms are something that occurs in every subspecialty, GI certainly included. In our world, we talk very strongly about this concept of the brain and gut connection. So just like you had said so well earlier on, ultimately every experience of pain or symptom we have is from the head. How we even interpret true pain from cuts and injuries in our extremities also has to do with how we perceive that internally. Along with that, one of the examples we commonly describe is even right now, as I'm trying to answer these questions, I feel some butterflies in my stomach. I feel a little bit nervous, and I hope I'm answering the question. And our other speakers probably did the same thing. That is a beautiful example of the brain and gut connection. Based on something here, we feel that physically manifested as a vague sense of discomfort. Now, one can imagine that certainly in many of our children who are seeing news reports about COVID, their parents are nervous, they're starting their first day of school, they see people wearing masks all around them. A lot of those same anxieties can manifest. Now, specifically what percentage, it's hard to say. I'm a subspecialist, so thankfully, because of great work done by my primary care colleagues, by the time patients come to me, I'm often obliged to rule out other things. So we are diagnosing more Crohn's, ulcerative colitis, celiac disease, liver disease, etc. But what I would say is that for our families, we know that the vast majority of times, at the very least, even in my patients who have a diagnosis of ulcerative colitis, let's say, there is always a contribution of how our emotional perception of the symptoms that we're going through is at least contributing 50%, let's say, to the experience that we have in dealing with that symptom. So succinctly, we still see a number of patients whom in all of the tests done for chronic tummy ache, chronic feelings of discomfort while eating, they still will end up not having anything abnormal found on their blood work and ultrasounds and whatnot. But regardless, I think the emotional aspect of a symptom always needs to be explored.
Padmaja, can I just 1 second? This is Sadanand. I know that we are coming to 12 and the presentations have been excellent. There are great questions, and like a cherry on the cake, you have brought Dr. Nikhil Pai. So I would like to request audience to give us a few more of their precious time so that we can answer a few questions, and most importantly, also give the vote of thanks at the end. So it may not take more than 10 more minutes. Padmaja, take over.
Thanks, Uncle, and thanks for answering that question too. I feel like I may be prioritizing my own questions, so let me just check in the chat really quickly about some questions people had. So I know there was one earlier around COVID and schooling. So the question specifically was, what are your thoughts on children going back to school in the COVID situation? So I would maybe ask you to speak on general safety about going back to school, given the guidance. And then in terms of crowds and stress, is there anything in particular to worry about with kids, and maybe touch on sort of children transmitting to family members or amongst themselves?
Yeah, you bet. Padma, maybe you can just prime me if I forget those things. I'll do a quick shout out to one question I see here related to the last one. Surekha, you asked about whether families are talking about mental stress or is it still a taboo. I actually do find many families do talk about it now. I think thankfully, honestly, guys, because of the work that you're doing, Padma, and your team, mental stress, mental contributions to disease is becoming recognized. Do I find a cultural component to that? Maybe slightly. I think that sometimes it is somewhat understandably a bit off-putting maybe to some families initially to be getting into the talk about mental stress, because I think many families find that if a practitioner starts or leads with that, he or she is not going to want to explore the other physical contributors to disease. I can say almost summarily, current physicians do not think that way. We see them as hand in hand, and speaking about the mental components does not mean we're not going to also be doing blood work and other things. I find families talk about this more often as well with their children. One other quick one here. Medication will have side effects, true or not, depends on the medication. All have some side effects, but it's a constant balance of risk and benefit. And further to that, examples we can discuss, but I would say talk to your doctor to learn the side effect profile of your individual medication. Very important right now. So about schooling. So this is a tough one to answer. Yesterday, when I was reviewing some of the slides, I was trying to figure out how best to type this out. So it depends. One of the things that we're seeing, and once again, please keep in mind, this is based on current community prevalence data across Ontario. If we start to see a rise in all age populations across, that will also come into our schools. And we're coming into a winter time where things are going to get tricky. Currently, what we find is that for the most part, especially in children under the age of about 10, and also in adolescents as well, it does not seem, thankfully, as a pediatrician, that children are very good transmitters of disease themselves that they did not bring into the school based on their adults around them. So maybe stated differently, children have obviously very dirty practices. They share things, they wipe each other's noses, all the rest. But we find that if they are not getting COVID specifically, that is brought from their mom and dad at home, that is not coming from the adults in their lives, there is nothing per se within that school environment that seems to be dramatically increasing the rate of COVID that they are going to then have and send back to their parents or their grandparents in the home. Okay, so some more comments on this. The other thing that we find is that this is just speaking about children. Thankfully, and this is almost based on international data, children who do get COVID do not seem to get very sick by it. As further examples, across McMaster Children's Hospital since March, we probably have had maybe probably less than 10 children admitted to hospital with COVID. And almost unanimously, they were found incidentally based on screening that's done at the time of admission. At Sick Kids Hospital, similarly, rate of maybe about 5 to 10 cases total since March. And once again, almost no cases had any complications secondary to COVID themselves. This includes patients who are complex care, so neurodevelopmental delays, hematology oncology with chemotherapy, and kids who are immunosuppressed. The other comment I'll also make is that what are the risks of not sending your kids to school? We know that in kids who are under the age of 5, also under the age of 10, there is academic acquisition that comes from being in school, but it's also about the social environment. And social skill building is as much part of what they're going to be getting from school as what they are having at home. That might vary a little bit in some of our adolescent populations. The other thing we are seeing, though, in significantly higher numbers is rates of increased mental health issues coming to our emergency departments, increased risks of suicidality in our adolescents, both successful, unfortunately, as well as attempted, and significantly increased rates of mental health issues. In adolescence, they may not need to learn how to share and not bite other kids on the playground, but they do need the social interaction of being around other peers. And in some of our more vulnerable children and adolescents, that is a cost of not being in school that needs to also be recognized alongside these worries about COVID. I'll just make one final comment. I don't want to be insensitive to how in many of our families, we have shared households where we have elderly parents and family members. It just does seem, though, based on data so far, that just going to school does not make that child be at significantly increased risk to come home with COVID. It is still important for the adults around us to be minding our own hand washing, because the rates so far don't seem to show that they are bringing it back home.
Great, thank you so much for answering that. I know I have one more question that I was hoping you would address. So we talked, and it's switching gears back to the mental health arena. So we talked about sort of signs where you might see whether it's young children misbehaving or older children maybe losing interest or withdrawing, maybe things that you might catch. But what about, for example, teenagers or adolescents who are seemingly doing great? They're doing great in school. They're performing really well. You know, let's say on social media, you can tell, you know, their friendships seem to be solid. Is it possible that those people might be struggling with their mental health? And if they are, how might we catch those?
Yeah, good question, Padma. I mean, please also, all of the presenters today, chime in, because you guys might have some other thoughts on this as well. Maybe they are fine. I hope that's not like too heretical to say, but maybe they are fine. You know, I think one of the nice things I've seen in many of my patients is like around this time, we're talking a lot about community mindedness, thinking beyond oneself, learning that there are certain populations like our elderly who are facing the brunt of this in completely different ways than younger people thankfully are. And I think that has allowed many adolescents to really feel a sense of civic engagement and purpose in a way that maybe they haven't felt before. The pandemic is a scary time for all of us, but it's also brought out some really wonderful opportunities and examples for youth. I think, though, another way to answer that is just, as you guys have been saying, just constantly try and communicate with your child and your adolescent. At their time, at their space. You don't always need to have this family dinner where you're discussing things that might feel a bit awkward and uncomfortable, but allowing a child, an adolescent, to discuss how they're feeling. So that's what I would mention on that. I'll just say one more thing, and then please chime in as needed. I think one other quick comment, though, is in younger children. I have an example because of my 2-year-old. They also, though, sometimes can take on some very magical thinking as well. So it's important to explore with them what their understanding of things are. For instance, concerns that maybe people are wearing masks not to protect against a virus, but because there is something wrong with the child. There can be some very creative ways of interpreting situations. So this idea of checking in constantly is needed both for very articulate adolescents, but also for younger ones who may not really understand the reason all these things are happening. Stop there. Padma, did you have any thoughts on that?
Yeah, thank you so much. I was sort of asking that as a means of hopefully touching or bringing home a point that we did talk about in our presentation. So I think exactly as you said, it is possible that everything is okay, and we can hope for the best in that case, and we would hope that people's coping strategies are working. But I think I wanted to echo what you said around still making sure that you're checking in, even on your children that seem to be doing great, seem to be having great grades, because you might not know what's going on in their own head. So we talked about this earlier in our presentation around expectations that we might have, either external, like maybe as parents, you might be telling them, I really hope you do well on this test. Oh, how did that test go? Even something as casual as that might be adding some of that external pressure. And oftentimes when that external pressure isn't there, I've found that especially among our community, there's a lot of internal pressure, especially around, even if it's not explicitly said, around wanting to achieve at a certain level, wanting to help, your family with economic mobility, wanting to be successful, wanting to fulfill your parents' dreams, maybe do what they wanted to do for them if they're not able to do it. So there's a lot of, I want to say, wishful thinking in that way as well, and expectations that we place upon ourselves. So I wanted to make sure that parents are taking that away too, that ultimately we really hope you talk to your children after today's talk, and that you're able to have some of these discussions a bit more more openly. And some of those open-ended questions that we suggested around how you might like asking your child, how can I help? Or is there anything you're scared of? Anything bothering you? Honestly, if I had children, I'd ask them maybe every day a little bit, like, is everything good? Everything doing okay? I might check in with my kids on a regular basis. So that's all for me. I don't know if there's anyone from our team who wanted to add anything at the end, or if there's any final questions, but I did want to thank Dr. Pai a lot for coming today. I know it was late notice, and we really appreciate you being here and fielding some of the questions. It's always nice to hear from a licensed health professional answering some of the questions when most of our presentation was done by some of us who are still in training.
Hi, Padmaja. This is Sadanand. As topic and the discussions are getting so interesting, unfortunately, the clock is getting to be our enemy. So we have already gone over 10 minutes. If you don't mind, we will start concluding this session.
Absolutely. Thank you.
And once again, Padmaja, Mayor, Shivan, and Sugi, excellent presentation. And especially thank you for bringing Dr. Pai. As I said, it's a cherry on the pie for sure. Before I give it to Dr. Lakshmnan, I would like to share sad news. I struggle very much whether to share it or not, but I think it is appropriate to share this. Earlier this morning, one of our friends, Dr. Pallavi Nadkarni, passed away after a brief illness. The special connection here is on April 19th, if I'm not mistaken, we had a webinar which dealt with stress, anxiety, depression, and how to deal with it. And she was extremely helpful and very greatly presented a fantastic presentation. And I'm very sorry to share this information. Very young Dr. Pallavi Nadkarni, we pray for her soul. We hope it attains the Sadgati. And with that, I'd like to pass the control to Dr. Lakshmnan, the president of SVBF, to give a closing remarks as well as a vote of thanks. Dr. Lakshmnan.
Greetings, friends. Want to thank Padmaja and the youth team for coming forward, sharing their thoughts, doing a lot of research to bring the information. And it is so appropriate, it is happening with the SVBF and the community center, Sringeri Vidya Bharati Foundation, where we had our own Jagat Guru. Before he was 32, he went all over India to share his knowledge and the vidvat to the community. Well, here we have in the 21st century, our children have come forward generously doing research and sharing their thoughts with community members. Today, I thoroughly enjoyed listening to our children. I want to say thanks to Padmaja, Sugi, Shiva, and others, and Dr. Professor from McMaster, Dr. Pai. As we always say, it is not enough to learn and yearn, but also learn to give back to the community. And when it happens with youth, you feel very thrilled that the message is coming from our children, learning to share their knowledge, investing and sharing. This is very, very fruitful to the community. And on behalf of SVBF and Ontario Konkani Association, want to thank Padmaja. She came forward asking whether she and her colleagues from CHERI can give a webinar. Padmaja, we want to thank you on behalf of SVBF board and also take the privilege of passing on from OCA that children like you come forward, youth leaders, and this makes our community fulsome, that we have active members, whether it is youth or adults, and we have a very active group coming forward to contribute to the GTA. Want to thank you again. Let us do more events like this and continue with this journey. I want to thank our friends, Ravi, Sreeram, Murli, for continue to doing this service to SVBF and WOCA. Thank you very much. Many hours of your time, your family time you can give to your own family you are sharing with us. I want to say thanks to you. And I want to mention, we'll have another seminar on October 4th. Friends, be there, because today the youth came forward. On October 4th, we are going to have a discussion of Adi Shankara, the great guru, Jagat Guru, all of you. Somebody is going to be talking about, Mr. Ramana is going to talk about. So continue with this engagement. Thank you again. Thanks for participating, helping our community. Thank you.
Thank you, Dr. Lakshmanan. Just before we adjourn, just want to mention that this project is recorded. It will be posted on SVBF website. So please let your friends and family members know so that they can access. Again, thank you all. Till the next webinar. Bye for now.